Movement of articulators shape the resonant cavities of the vocal tract, and altered resonances give the acoustic output that we call speech. Resonance is the voice quality that results from the vibrations in the pharynx, oral cavity, and nasal cavity. The balance of these vibrations in these areas directly affects the quality of speech and voice. How the oral cavity shapes speech sounds is the source filter theory of vowel production. This theory states that a voicing sound is generated by the vocal folds and routed through the vocal tract, where it is shaped into sounds of speech. Changes in the shape and configuration of the tongue, mandible, soft palate, and other articulators govern the resonance characteristics of the vocal tract, and the resonances of the vocal tract determine the sound of a given vowel. The lips are the outermost articulators relating to speech. The lower lip achieves a greater velocity and force than the upper lip and does most of the work to achieve closure. The lower lip is capable of rapidly altering its rate of closure to accommodate a variety of jaw positions due to it containing the mandible and the mentalis muscle, which are not part of the upper lip. The lips are observed during an oral mechanism exam in which many physical and overt factors are taken into consideration. The mandible, the lower jaw, is the second largest mobile articulator, having many jobs. The mandible is responsible for assisting the lips, changing its position for tongue movement, closing when necessary, chewing, helping speech be the most intelligible it can be, and more. The mandible is an unpaired bone making up the lower jaw of the face. The point of fusion where the two halves of the mandible meet is the mental symphysis, marking the midline. The maxilla, the upper jaw, is an immobile, vital structure of the skull. It holds the upper teeth, the lips, the hard and soft palates, and plays an important role in mastication and communication. The tongue is the largest mobile articulator. It is involved in the production of many phonemes, but only 20% of its capable force is used for speech activities. The tongue is capable of a wide variety of movements. The velum, also known as the soft palate, acts as a gate to the nasal cavity during speech production. In its raised position, it blocks off airflow through the nose, allowing for proper production of certain sounds. The velum is the soft tissue on the back roof of the mouth, the hard palate. The levator veli palatini contracts to close the velum for production of these non-nasal speech sounds. The hard palate, also known as the roof of the mouth, is made up of bone and holds the roots of the teeth and contains the alveolar ridge. The alveolar ridge is located right in front of the upper teeth on the hard palate. The hard palate also has a midline raphe, a ridge or a groove. The hard palate is another immobile articulator. The posterior 1/4 of the hard palate is made up of the horizontal plate of the palatine bones. The articulatory system as a whole is responsible for shaping the oral cavity for the production of speech sounds. The oral cavity contains the tongue, the soft and hard palates, the uvula, and the teeth. The pharyngeal cavity contains the tonsils located at the base of the tongue and connects to the oral cavity. It's the area behind the oral cavity. The pharynx regulates how food moves to your esophagus and how air moves to your lungs. The vocal tract contains the mouth, which is also the oral cavity, and the pharynx. The nasal cavity, in relation to articulation, is involved by the altering of the airstream that passes through it, lowering the velum to produce certain sounds. The nasal cavity is divided into two separate cavities by the septum, and in each cavity are the nasal vestibules, the respiratory regions, and the olfactory regions. The vomer is an unpaired midline bone making up the inferior and posterior nasal septum. It is the dividing plate between the two nasal cavities. The vomer articulates with the sphenoid rostrum and perpendicular plate of the ethmoid bone in posterior superior margin. The ethmoid bone is a delicate structure with presence in the cranial, nasal, and orbital spaces. The ethmoid bone is the core of the cranium and facial skeletons, kind of like an apple. The zygomatic bones make up the structures that we generally identify as the cheekbones. The zygomatic bones articulate with the maxillae, the frontal bone, the temporal bone, and the sphenoid bone, and makes up the lateral orbit. At the base of the orbital margin is the maxillary process. The occipital bone is an unpaired bone that overlies the occipital lobe of the brain and makes up the posterior brain case. It articulates with the temporal, parietal, and sphenoid bones. The paired parietal bones overlie the parietal lobes of the cerebrum and form the middle portion of the brain case. The frontal bone is an unpaired bone that makes up the forehead. It's the anterior cranial case and supraorbital region. Near the middle of the skull, the coronal structure marks the point of articulation of the frontal and parietal bones. The frontal bone articulates with the zygomatic bones and the nasal bones. The zygomatic major arises lateral to the zygomatic minor on the zygomatic bone. It takes a more oblique course and inserts into the corner of the orbicularis oris. The zygomatic major elevates and retracts the angles of the mouth, helping in smiling. The zygomatic major runs from its origin on the canine fossa of the maxilla and inserts into the corners of the upper and lower lips. The depressor labii inferiors muscles originates from the mandible at the oblique line and runs up and inserts into the lower lip. Contraction of the depressor labii inferiors dilates the orifice of the mouth by pulling the lips down and out. The depressor anguli oris originates along the lateral margins of the mandible on the oblique line. Its fan-like fibers cover the orbicularis oris and the upper lip at the corners of the mouth. Contraction of this muscle will depress the corners of the mouth and help compress the upper lip against the lower lip and produce a frown. The risorius and the buccinator muscles insert into the corner of the mouth and retract the lips. The risorius is the most superficial of the two, originating from the posterior region of the face along the fascia of the masseter muscle inserting into the corners of the mouth. The buccinator is the dominant muscle of the cheeks, lying deep to the risorius, following a parallel course. It originates at the pterygomandibular ligament and runs forward into its insertion at the upper lower orbicularis oris. Cranial nerve 7 is the facial nerve, which innervates into many muscles of the face, containing the motor, sensory, and secretomotor nerve fibers. It helps control the muscles that help you smile, frown, wrinkle your forehead, and raise your eyebrows. And it carries nerves that are involved in providing taste to the anterior 2/3 of the tongue and produces tears. Cranial nerve 5 is the trigeminal nerve, which is the nerve that is responsible for sending pain, touch, and temperature sensations from your face to your brain. One section involves motor function to help chew and swallow. There are 2 trigeminal nerves, one on each side of your body, both beginning in the brain, traveling throughout your head. Cranial nerve 9 is the glossopharyngeal nerve, which is the cranial nerve associated with the sensation of the tongue and the pharynx. It's a critical nerve for swallowing. It originates from the medulla oblongata and ends in the pharynx. The cranial nerve 12 is the hypoglossal nerve, which is the cranial nerve that innervates all the muscles of the tongue with a solely motor function. It originates from the medulla oblongate of the brainstem. Cranial nerve 10 is the vagus nerve, and it is the cranial nerve involved with vocal fold action. It carries sensory fibers that control the heart, lungs, and digestive tracts. The vagus nerve is the longest nerve. Just like any other system of the body, there can be impairments to the articulatory system. A broken jaw has a direct impact on articulation. You can break your lower jawbone, the mandible, in more than one place, but regardless of where the break is or the quantity of breaks, it is a medical emergency. Broken mandibles are the second most common facial fracture, nasal fractures being the first. There can be many different signs and symptoms of a broken jaw depending on how serious the break is. Symptoms can range from a bruised cheek to one being unable to open or close their mouth. A broken jaw can affect one's ability to eat, speak, or breathe, and furthermore, permanent complications arise if not treated properly. Depending on the severity of the break, treatment can range from being put on just an all-liquid diet to surgery involving metal plates or bars and the jaw being wired shut. A cleft palate is a birth defect that forms while the fetus is developing in the uterus. Cleft palates are when the tissues of the upper lip and the roof of the mouth don't join together properly. Tissues migrate and develop normally but fail to fuse, or the fusion breaks down. Surgery is required to repair cleft lip and cleft palates. A cleft lip can be either unilateral or bilateral, occurring along the premaxillary suture, and can involve both hard or soft palates. It is possible to have a cleft lip without a cleft palate without a cleft lip, or both simultaneously. If not surgically taken care of, it can result in a baby having difficulties eating from either a breast or a bottle, and eventually result in trouble with speaking. Issues with teeth can also arise.